Folks, thanks for coming on with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next hour or so going through some details to help folks get more information and learn a bit more about veterans health care. There's going to be a ton of material thrown at you here really quickly, but much of the material that we reference will come to you as part of the follow-up to today's presentation, and that should come to you later today or tomorrow when the recording of this presentation updates. Because yes, it is being recorded, and the link to that recording along with the follow-up will come to everyone who has RSVP'd to today's presentation. A bit of housekeeping to start. If you have questions as we go through the presentation, please use the question box on the GoToWebinar software, and we'll make certain that we address them all by the end of the presentation. If we have to do some research, well, you'll get that very quickly as soon as we find the answer for you. A bit of background about our organization. Premier Marketing is a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We have offices across the country, and we act as an insurance wholesaler, providing insurance product to the public through independent insurance agents such as yourself. Those contracts are at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so that means we recently celebrated a milestone in our history, our 50th anniversary. We feel that's quite an accomplishment for what started as a small family agency in rural Nebraska that's grown into one of the largest programs of its type, offering Medicare product across the country. We do so through a full insurance portfolio that include Medicare programs such as Medicare Advantage and Medicare Supplement Plans and the standalone Part D prescription drug programs. We have a full portfolio of life insurance and annuity products that include final expense life insurance, pre-need programs, and long and short-term care plans are part of the portfolio, as well as is disability income and those ancillary benefit programs that include dental, vision, and hearing programs, critical illness and cancer, and hospital indemnity. That Medicare Advantage portfolio includes all the national carriers and many of the strong regional carriers that help you in your marketing efforts. And that same philosophy carries over to the standalone PDP offerings, where the national carriers are there for you through our organization. Our Medicare Supplement portfolio is very large and robust. We've got a couple of new ones coming out here very quickly, so watch for some detail on that, because we not only offer the contracts, but the tools that help you be successful in this part of the Medicare world. Those ancillary products, in each of those categories, you've got the national leaders, the carriers that provide the programs that help you financially protect your prospects and clients for those little gaps that no base medical coverage will completely encompass. So they're there for you with some really innovative ways of helping you market as well. When we look at the Medicare market opportunity, before we dive into the subset of the veteran population, we see that we have a very burgeoning market. And if you look at this particular slide, you can see where it's almost exponential, the curve up, with folks aging into Medicare all the time. But that is only a portion of the Medicare market. And if you consider that on a whole, your market, well, you're missing out. Because, well, on part of it, people, just because they turn 65 doesn't mean they're accessing their Medicare immediately. A big portion do, but some continue to delay Part B, maybe because they're working or for whatever circumstance. And it's a little different situation moving forward. And you also have the folks that do access Medicare benefits because of disability. And it's actually about a sixth of the population. So it's a very big portion of the folks that we can help in this market, and a piece that's often overlooked by agents throughout the different portions of the country. It's a diverse population where you have people who have challenges with health. 2/3 of the population have 3 or more chronic conditions, and half the population has a challenge with their wallet. Now, this income median has grown to 26.2, but that is still a meager number when you look at the cost of everything that folks have to deal with. Oops. There we go. Now, when people come into Medicare, they have a number of choices to access care. And this is particularly appropriate for today's presentation because one of the pieces of base coverage is a decision. And as a sales manager of mine at Prudential 30 plus years ago used to tell me, a decision to make a decision is a decision. And so folks, when they have accessed Part A because they worked more than 10 years in their life and they get it premium free or have been married to someone who did, they have to decide whether or not they're going to opt into Part B coverage, the medical coverage. Some do not. And in the population we address today, it's a much larger percentage of folks that do not than we see in any other segment of that population. Some of the folks then will decide to self-insure for the medical cost and pick up a Part D coverage for their medications. This too is a key component in the differences in our market of today with the veterans, because many of them don't pick up Part D and access their prescription coverage through the VA system. Since it is counted as creditable coverage, they can always change in the future without penalty, unlike the rest of the population that doesn't have creditable coverage from the time when they're first eligible. But it's a decision they have to make as to what is best for them. And we discuss that in depth in just a bit. There are folks that will take out a standardized, modernized Medigap policy, a Medicare Supplement program to cover what Medicare doesn't. We see a portion of the veteran population that chooses to do this. We have some statistics on that for you as well. And we also have a number of folks that choose to go the private route, so to speak, where they're assigning their Medicare benefits to a private insurer and access all of their benefits through that Part C company. They then have, in many circumstances, additional benefits that are delivered to them based off of the company's offering. It is, as we see here, a very diverse population that we deal with. So having a portfolio of products to help address some of the challenges that this population we serve has is something we need to do. It's also interesting to see that the plan choices upon initial Medicare enrollment, notice I say that, not necessarily age in, but the scale of folks that are coming into Part B, you see almost an even split as to choices between MA and MedSup programs. You also see a piece that remains with original Medicare only. That is a segment of the society where we see veterans in many circumstances, because in most circumstances, they don't choose either of these. Can they? Yeah, well, we'll discuss that in a bit as well. One of the things we see too, for those that aren't as familiar with the Medicare world, is the fact that it, like most industries or most segments of the society that's specific to one particular topic, it has its own language. So we have a guide for frequently used acronyms that is available for you with the regular follow-up that we send out. Since it's going to be so large, we may have to do a couple of emails to get it all out to you. And if so, this will come to you automatically. If not, I put a note in there for you to just respond back and request it, and I'll get it right to you. Now, folks, when they get into Medicare, have different enrollment periods that they have to observe in order to change coverages. And these are the standard programs that the standard timetables that we see dictated by CMS for the Medicare population. But they also have exceptions. And this is a list of 20 of the general exceptions that are available. There's an additional one because of Mother Nature and how it has affected different parts of the country. But you'll notice in this as we go through it, well, just because you're in the VA doesn't mean you have a special election period because you have creditable coverage for your Part D, which would allow you into a standalone PDP program or an MAPD plan. But there may be other of these special election periods that the veteran qualifies for based on other circumstances. And what we see in some of the detail that you'll have is many of them will qualify based on income and assets. So the LIS or MSP programs might come into play with a number of these individuals. So when we look at veterans health care, we're looking at a monster of a program. It has different subsets within it where you have the standard VA coverage, and you have different programs such as CHAMPVA and TriCare, TriCare for life once a person's on Medicare. So we're going to go through these and discuss them in detail for you. But if you look at the population based on age, because we can't tell the disabled people by their age bracket, it's not details that are available to us, but at 65 and older, we see that it is a population that, well, it lays out across the country fairly significantly. And if you look at the lightest section there, down in the deep south, southeast, that's the smallest portion of the population, and it's 39%, unless you go to, well, that's it. So what we see is an equal opportunity across the states. So no matter what market you're in, you're going to run across these individuals. And you'll see that of the 8 million plus people that are served by the VA, 48% of them across the board are 65 plus. So it's a big portion of the market and something of the VA market. And it's something that we need to be aware of and address. These are folks that, in a generalization, VA patients tend to be older and less socioeconomically well-off than veterans who do not rely on VA for care. They are pleased with their coverages in many circumstances, but what you'll see here is a difference of almost 21 and a half points in this portion, but 14 points when you look at the over 65 people when it comes to whether or not they're accessing care through the VA. Is this good or bad for us? Well, actually, if they're of lower income, we have a better chance of having a special election period to address their needs year-round. And what we're looking for is to give them options, basically, because you also have a good portion of these folks when you look at income by group. And let's look at 2017. These are the latest numbers that were available to us. You go from basically the 24/9, which is pretty close to 150% of federal poverty level, down. You have a good portion of these folks that are economically in need of our assistance as well. Here's how it lays out across the states. So you see a lot of the blue hair heaven down here in Florida, with a good portion of those folks that we can help in that particular area. This is one of the slides. When I ran across this graphic, it gave me kind of a funny feeling, because when I first started Medicare sales as a agent back with Prudential, and I ran across a few folks that needed Medicare supplements, and even though Prudential underwrote AARP Medicare supplements at the time, was not available to the broker situation. And so what we have then since that period of time when I was selling Medicare Plus Choice plans before Billary changed some of the funding and it changed, we had a much larger population in this area here with World War II and Korean War folks. And we see that that generation, that greatest generation, is passing. So it's becoming younger, the veteran population, but it's also shrinking, because what we have at this particular point in time versus here in the Gulf War and post 2001, we have a change in medical proficiency as well. So many of the folks that would have passed away in these earlier conflicts are alive, but they come back with different challenges with their bodies. We see that a lot with amputees and some severe wounds that they survive, but hey, they are also the folks that have a service-connected injury, so they have a higher priority in accessing the VA as well. So what we have is an aging of this population and a little different than when I first started looking out after it. And what we see with folks that report other types of coverage, you can see this where Medicare, half of the population has it when they in this reporting of a pool of a survey that came through for us. And it's going to be part of that entire survey, part of your follow-up. So it, along with much of the links that we're showing, that will come to you as this presentation will come to you as well. So don't worry about taking notes. You have also some different categories in there that we will discuss as well. So TriCare and TriCare for Life and the other coverages within the VA will come into play for you too. You'll notice that a good portion of the TriCare population, while if they have TriCare for Life, they got to have Medicare. It's one of the requirements for that particular coverage. And then you have a big chunk of the folks that don't have any other coverage at all. So as you deal with this population, you need to become proficient in helping them either pick up Part B, which they may have declined, and explaining the ramifications of the penalties that come with that, and to basically run through some details as to cost efficiency of these programs. And you can see, boy, the southern parts of the state, it's rimmed with uninsured enrollees. Then you look at some of the folks that have that Medicare coverage and break it down. Obviously, you've got a good chunk of it that's 65 plus, but remember we talked about the disabled folks. Here's a good graphic demonstration of the percentages that are there. You know, the challenge is how you find them and identify them. There are some different ways that can be done as well. You combine that with some of the income challenges that they have, and we have a population in dire need of our help. So you've got a bunch of detail here with folks that are Medicare, and then you'll see the folks that also have Medicaid. This is a population that we can really help with as well with our skills in low-income subsidy and Medicare savings plans qualifications, because many of these folks that qualify for this don't have it in place. And when we help them get that coverage, we create that special election period, and it gives us the opportunity to examine other coverages for them. So if you go back into the history of the VA, well, it started at the end of the Civil War when President Abraham Lincoln was addressing the needs of care for our wounded veterans. And you have different states with different criteria for the benefits that come into play. And you will see different qualifications based on the different service levels or the different levels of qualification. And we'll go through those in detail. What confuses the issue a bit even more is many of the folks that are veterans, they may be past 65 or aging into Medicare, and they may be in the health insurance marketplace at this time as well. So much as the VA doesn't interact with Medicare, the folks that are in the marketplace, that is a different coverage than Medicare. Obviously, we've got some different assistance there to help you identify those differences. We're not going to go into that today too much. So as I mentioned, you have different priority groups that are numbered 1 through 8, with 1 being the highest priority for enrollment. And it helps with then how people qualify and how they access the care. If you can read this as quick as I'm going to roll through it, you got better eyesight than I, most assuredly. But what you see, the people in the priority groups 7 and 8, they're income-based to a degree as well. When you get into 6, you're dealing with veterans with 0 compensatable service-related disabilities. Why are they going to the doctor or the hospital then? Well, they're getting old. What happens with our bodies when we age? You get some different challenges there. So you see the folks that are of highest priority are the folks that mostly are the younger people and coming back with service-related injuries. Not that the older population doesn't have that, but a greater preponderance of those folks are younger and won't necessarily fit the demographics we're looking for to help them with Medicare coverage. Get all that? So that survey that I mentioned is based off of some different demographics, and it'll tell us where people fall into those categories. And you'll see that demographically, enrollees are getting younger, and those that are younger than 45 they'll have to increase their percentage from 15 to 20 over the last 5 years. We've been in a long police action / war, the longest in our history, and it's generally fought by younger men. So that's part of the challenge that we see coming into it. We also find that many of the older the older veterans have challenges when it comes to sometimes homelessness, sometimes dealing with not enough money. Remember that second category of the characteristics where half the population is financially challenged? You have a circumstance there where that really applies to some of our older population. When we look at some of the things that qualify a person for VA coverage, because not all people who served in the armed forces qualifies for it, it's based on different service to our country in the different branches, and they have to be honorably discharged. And you'll see that reservists and National Guard members who are called up may qualify as well based on certain criteria. The health care eligibility is not just for those who served in combat. So those that stayed stateside or in one of the areas that was support to an armed conflict, they qualify as well. And that care is not just for service-related injuries or medical conditions. However, that puts you in a higher priority group as well. It's also important to note that it's not just for men. VA offers full health care service to women veterans as well. And so those 8 different categories that come into play, we will see some of the folks that are of higher income, they may have to pay more for that service that they're accessing at the VA than folks that are of a lower income. Some of the things that we see as well is we really need to look at the veterans' reliance on the VA for prescription drug programs. And we see that most enrollees, even though they report having health coverage, prescription drug coverage rates vary significantly by the insurance type. So we see then a portion of that population that is very much a target or a prospect, I should say, not fair to say target with the VA, for additional coverage with prescription drugs, and we'll explain that rationale as well. You'll see, however, that much of this population, almost 2/3 of it, they get a monthly prescription at least from the VA, and on average, 3.5 prescriptions per month. If a person has both Medicare and VA benefits, the 2 benefits are independent of each other. They don't work together. Medicare doesn't pay for any of the care that someone receives at a VA facility. And in order for the VA to cover the care, they generally have to receive it at a VA facility. In order for Medicare to cover the care, you must receive care at a Medicare certified facility that works with Medicare coverage. VA benefits, general VA benefits, will not pay for Medicare cost sharing, the deductibles, co-payments, and co-insurance. We'll backtrack on that when we get to TriCare for Life, but remember, that's only about 1 in 5 of the VA population, and it is a circumstance then that if a VA authorizes services in a non-VA hospital but doesn't pay for all of them, the person is out of pocket for it unless they've got the coverages that come into play that are available to them as a Medicare recipient. This is kind of a repetition in many areas, but it's an important point to repeat because what you have here is circumstances where the VA coverage can vary from enrollee to enrollee. And one of the things that we might see in the very near future, particularly with the challenges in the budget, is a cut of funding to the VA, and some of the vets in the lower priority groups could very well lose their coverage from VA. And what you have in a circumstance when someone has Medicare and VA, it widens the coverage. So the VA covers the things that a person accesses through the VA, and with Medicare, they're covered if they go to a non-VA provider accepting Medicare. That's an important point for those folks that are living a distance from the nearest VA facility. And if a person doesn't adhere to the regular Medicare guidelines and they're past 65 and they lose VA coverage, or for another reason decides they want Medicare, they hadn't signed up for the B, they're going to have that penalty, that surcharge of 10% per year, and penalties that then become very expensive and remain with them for the rest of their life unless they qualify for low-income subsidy or an MSP or Medicaid. Since the prescription coverage is creditable, they do not have the penalties that they would have for Part D that others would have as well. One of the things that's important to note that the health coverage with the VA isn't an HMO. It is established by the federal law and regulated and funded through those appropriations. It's not really the same as an insurance contract. Veterans don't pay premiums to access VA care, and they aren't obligated to use VA as an exclusive health provider. You'll actually see in some upcoming slides where they actually recommend people get Medicare, maintain that coverage, and don't give up any other type of assistance that they may have. You will see some veterans that will pick up Part B and then decide, well, I'm just going to access at the VA and cancel their Part B coverage. It's a bit of a risk. They're taking a gamble because of the funding challenges, and between the time period when they drop B and then were to pick it up again, that penalty comes into play. There are also reasons, valuable reasons why a veteran would want to consider the flexibility by having both, because they can actually prescribe or access non-VA physicians. Part of the challenge you have with a lot of the VA facilities is they rotate through the different providers, the physicians, the PAs, the nurse practitioners, so they don't always have a relationship with an individual like they do with doctors in private practice. And you will see also some medications that are available to the public that aren't yet on the VA formulary. Now, if they're prescribed by the non-VA doc and filled at those prescriptions at local pharmacies under Part D, there's not a challenge. But much as any other prescription that is laid out, prescribed by a private practitioner, if they take it back to the VA to get it filled, they won't honor that civilian physician. They still have to have the drug prescribed by a VA medical professional. You'll also see that many folks find as a reason to seek care outside the VA is because they had easier access to care, or they had a relationship with a provider outside of VA who they really like and trust. Two biggest reasons for it. But you'll also see that a smaller number of enrollees used other facilities for basically due to perceived ineligibility. These are the folks in those lower priority groups, and generally they have lower levels of income, and those are folks that we can really help with the other coverages that won't interfere with their VA benefits. A graphic slide as to those different rationale that comes into play. And one of the things that you see, and that is a common perception a lot with VA healthcare, is the wait times. When you have a site that actually you can go to as a veteran, click in information and it'll tell you how long your wait is, you know you might have a large demand for those services, and it's something that could be difficult for folks that are looking for care a bit more rapidly than they might get it at a VA facility. It's important to note, once again, VA cannot bill Medicare for any services. By law, VA must bill private insurance plans. So if one of the veterans has a Medigap policy, they can bill them for the difference. Prescription drug coverage, as I mentioned, is creditable, and VA healthcare, however, is not. So that's that 10% penalty for the Part B coverages. What we are seeing as well are some new rules that are expanding access for veterans outside the VA facilities, particularly for those that are a distance from the facility. But even with that change, a veteran should consider Part B enrollment when they're first eligible, because they don't need to worry about getting the authorization with that non-VA provider. And as I mentioned, the VA encourages veterans to enroll in Medicare. Veterans enrolled in both programs will have access to community physicians under Medicare Part A and B and can obtain prescription drugs not found on the VA formulary if prescribed by community physicians and filled at local retail pharmacies. An interesting turnabout on that is some medications that aren't yet available to the general public as a generic will show up on a veteran's formulary. I'm taking a blood pressure medication that is a name brand. The only way I can access it, my older brother, who is a veteran, is accessing that same medication at the VA as a generic. So it's an interesting little twist there. For some of the things that we need to remind folks of, that they have to pick up the Part B when they're first eligible, or be aware of that permanent 10% higher premium for the year that they were eligible for Part B and then enroll. These folks can enroll in an MA only, an MAPD or PD program. It gives them the option in many circumstances with some of the unique offerings that are out there now to coordinate care for multiple illnesses, because we'll see that their bodies are being challenged as well. But it also gives them an opportunity to access prescription drugs locally without having to use the mail service or a trip to the VA facility. Can't stress again enough, VA benefits must be accessed through VA providers. Medicare Advantage or PDP benefits must be accessed through civilian providers that are part of the network. So you have an opportunity then to play both back and forth when you look at prescription drug coverage, where you see this can be of real big help to a veteran, and it won't interfere with a regular veteran's access to drug assistance or drugs from the VA, is that population that is of lower income, and in many circumstances, if they qualify as a full participant in the low-income subsidy extra help program, they may not have to pay for that program at all and get their drugs at a substantially lower price than what the general population has. So it gives them access to medications that in many circumstances really makes their life easier. Let's say, for example, a veteran has A and B and they have a Part D program. They go to a doctor, local doctor, because they have a flu and it's a distance to the VA facility. They can't get in time. They have a local person that they access for that. They can then get those prescriptions filled locally as well, and it's a much more convenient process than going through the VA in that circumstance. So some of the other things that we need to once again stress is the orders can't be crossed. So a VA beneficiary enrolled in an MAPD can't fill that prescription written by the MAPD network physician at the VA pharmacy. The copays rates are lower due to drug classification on the VA formulary in certain circumstances too. What you have when they're both programs are separate benefits, and that's something to remind ourselves of unless we have an individual who's a veteran, maybe a higher income veteran that's not a TriCare for Life recipient. They pick up a Medicare supplement, and you will then see the VA file against that Medicare supplement. What we have then too is the fact that the medications that a veteran procures at a VA facility, it doesn't apply to their Part D true out-of-pocket cost. So that's something to consider. The medications they are getting at the VA might be less expensive, but if they're a heavy utilizer, sometimes it might behoove them to do it through the private system because they know they're going to blow through it eventually. It will help them get to their catastrophic care a bit more quickly. Here's that Part D data that we were talking about earlier, where you have about 32% of the population that has D coverage as a veteran. A portion of it's missing, they can't get the data, but you have 60% of that population, nearly 59%, that don't have Part D coverage, and sometimes it's just an education process with those folks. They don't feel that they may qualify for one or the other, and that's important for us to have the information available to educate them so they have a true idea of what their choices are. You'll see that too in the map where the coverage comes into play. There are veterans that might consider enrolling in a Med Sup program as well, and some of those key areas, obviously, for the coverage, so they can take care of those expenses that aren't covered by just Medicare and they're accessing care outside the VA coverage. But it's also, you'll see veterans that are a distance from a VA facility, so they're accessing care with just regular Medicare coverage without a stop loss and the deductibles and coinsurance that come into play. They aren't close enough to a VA facility to access it with any great deal of convenience. So they, as they can afford those programs, become a good candidate for that coverage. Or they may be one of the folks that are in the lower priority groups and could potentially lose their benefits, and it gives them then the option to use local doctors and hospitals. There are many folks that, regardless of their coverage, feel that there are certain facilities that are best suited to treat certain conditions. Here in Texas, we have a large number of people that think that MD Anderson down in Houston is the bee's knees when it comes to treating cancer. You have the Mayo Clinic in the upper Northwest, Sloan Kettering in New York. You know, I have different places where someone would want to go for treatment of their cancer. If they have just Medicare, they're going to come out of pocket pretty healthy for that because, hey, that's 20% costs. So this gives them then an opportunity with costs with no stop loss. So that gives us then the opportunity to help those folks make certain that they have choice when their bodies do something they are not aware of. When someone joins an MA plan, they don't lose TriCare for life or the VA coverages. They continue to receive, they can still continue to receive coverage at a TriCare facility or the VA. The PDP program gives them the option to roll out into different programs outside the VA system. And you then have a network of local docs in an MA plan that gives folks greater opportunity to choose different physicians, not just for primary care, but for the different specialties that many people encounter when they get older. And because of the preponderance of programs in the Medicare Advantage world that are available at no premium, and even the portion that is there with one of the give back programs, very popular for the veteran population because it helps reduce that Part B premium, and in many circumstances gooses some of the other coverage if they're going for just an MA plan. It's a great opportunity for them to choose from different options that are made available to them, because quite frankly, what you're doing is teaching. You're providing the information so they have an opportunity to choose what is best for them, what may well be their best fit. This gives you a bit of a Ben Franklin close, in a manner of speaking, when it comes to VA folks and some of the benefit differences they have with an MA or an MAPD program. Once again, VA benefits for the medications are creditable, not for the Medicare health benefits. That would still be a penalty if they didn't pick it up when they're first eligible. As I mentioned, when we were looking at the SEPs, it doesn't create a SEP by someone having VA benefits. We have to look at the different SEP opportunities to see if there was something we can do mid-year as well. Otherwise, they have the standard enrollment programs or periods that are applied to them as well. When we get into CHAMPVA benefits, boy, I got to tell you, the internet can be a wonderful thing, because this particular site will roll through you and give you all the information you need when it comes to CHAMPVA. It then also tells you whether or not a person is eligible and how they're eligible for the CHAMPVA and what the differences are when it comes to Medicare qualifications. You have an opportunity to then educate in this circumstance as well, because many of those folks don't realize that they may be eligible for both programs. They think, okay, I'm with CHAMPVA. I don't have other options to go along with it. Well, not so, said the wicked, not so. You have different qualifications based on different time periods and ages as well. Some of the things where we see real restrictions when it comes to the VA and some of the benefits they deliver or don't lay into some of the ancillary benefits that are covered by programs we offer as well as agents. Dental, hearing aid and eyeglasses. So some of these things that are base needs of the general population, much as a person on Medicare outside the VA system needs to look at those coverages as well. It's also something that really prompts a lot of veterans to seriously consider a Medicare Advantage program. We realize that some of these benefits may be discounted with some of the Medicare supplements. That might be a deciding factor as well, but generally those discounts don't quite equal some of the extras a person gets with a Medicare Advantage plan. When we get into TriCare for Life, you have a handbook that is available for you that goes through and examines this portion of the population. We saw from some of the earlier statistics that about, 19.8%, I thought it was, 20% of that veteran population qualifies for TriCare for Life. This goes through and it speaks to you about the different benefits that are available to this population. It's important to note that TriCare beneficiaries must enroll in Medicare upon gaining that Medicare eligibility in order to retain their TriCare Life coverage. If they choose not to during their initial period, or they disenroll and stop paying their Part B premiums, TriCare for Life is suspended until that Medicare enrollment is reestablished. So some different things that we come into play here. This is that 20% of the population that had it, 20% of the veteran population. Well, we know they have other coverage. That's why some of those percentages in their early slides, well, they might be in more than one category. The Part A, they don't have to pay for generally. The Part B premium, well, we all know about IRMA, and if they're of higher income, over, 87,000 now, they will pay extra for that Part B coverage. And if they pick up a MAPD or PDP program that a higher income, they have the surcharges for that as well. TriCare is the health insurance program for qualified military benefit individuals and their beneficiaries based on years of service. It's a program for qualified folks if they have A and B, and then it's administered by CMS. We have a circumstance where someone is on Medicare. Medicare is the first payer, and TriCare acts as the supplement in those circumstances for that coverage. It's important to note that if, much as with a Medicare supplement program, if Medicare doesn't pay because they decide the care is not medically necessary, TriCare for Life doesn't pay either. So this is where some of those ancillary programs, such as a heart attack, stroke, cancer program, or a hospital indemnity program, can come into play. Now, TriCare for Life beneficiaries can appeal to Medicare's decision. Anybody on Medicare can do that. But in the meantime, if Medicare reconsiders and provides some coverage, then TriCare for Life would also consider coverage. These are some of the things that are the differences with what Medicare pays and then what TriCare pays. It gives you an opportunity then to look at different services that are covered by one or the other. And keep in mind, a TriCare for Life recipient can enroll in an MAPD or an MA only plan, but if a TriCare for Life recipient enrolls in an MAPD program, it could affect their ability to access benefits for TriCare for Life. And that's why many of the companies will recommend the MA program for these individuals. A lot of it depends upon where they're accessing the care and how the person that's directing those programs at that place decides where they are in the system. It is important to note that if a TriCare for Life recipient asks for an enrollment into an MAPD plan after being informed of the risk to their TriCare for Life benefits, the sales agent must continue with the enrollment. many circumstances for agents that have been in the market for a while, well, they basically tell them up front that you have great coverage, you don't need to look at this. There may be certain benefits, however, in the MA program or MAPD program that might well provide impetus for them for an enrollment. Why? Well, there's a focus on the health and wellness benefits. The annual physical is covered with an MAPD program or an MA program. It's not with the veterans coverage, with the TriCare for Life coverage. There's an emphasis on the preventative screenings, the greater network to choose from, and for many of the folks, as we mentioned earlier, some of the VA folks have multiple chronic conditions. The targeted disease and health management programs in the Medicare Advantage programs can be of great help to these folks as well. They offer predictable co-payments for individuals with the different coverages. And you'll see in certain areas, depending upon that TriCare for Life recipient, there may be some things that it behooves them to do additional coverage, because the hospitalization coverage in a TriCare in-network hospital, they're going to come out of pocket for it. And depending upon how long they stay in there, could be pretty healthy. If they are a traveler and they are, well, I'm retired, I'm going to go see the world, TriCare for Life covers 25% of those allowable charges. You'll see many of the MA programs have worldwide coverage. Physical, as I mentioned, is not covered with TriCare for Life. It is covered under the Medicare Advantage programs, and you'll see many of the ancillary benefits that don't get assistance from the governmental program with the veterans that you do with many of the MA programs, including those health club memberships that are a great allure to many of the folks. Vision, hearing, preventative dental, and diabetic supplies can be key differentiators as well. If a person is a member of both a Medicare Advantage and a TriCare for Life plan, many circumstances, the plans don't have additional cost. And in many of these circumstances now, there's a big push in the Medicare Advantage world for certain programs to be offered with that buyback, where part of the benefit structure they get by enrolling in those programs is a subsidy of a portion of the Part B premium that every Medicare beneficiary is suspect to. That can be a great enticement for veterans that are paying that coverage or debating as to whether or not they'll drop it. This gives them an opportunity to recoup some of those costs. And it also gives them an opportunity to get additional assistance from TriCare for Life as a secondary coverage off the MA. They have to be aware of how they file it. And that is a circumstance where what I call the good, the bad, and the ugly coverages with MA programs, where that therapeutic radiology at 20% in a lot of the programs, that can be covered by a claim to TriCare for Life. And one of the things that we send as part of the follow-up to today's presentation are these forms that we reference here. So it's something that you will see important for us to be aware of, not only the claim process, but how the claim is filed. And those are filed through that benefit counselor at the military base, where their care is coordinated. And this is important, that they have a good relationship, or at least a nodding acquaintance with these individuals, so they can get full coverage in many circumstances for their health expenses. You also have other health insurance that might come into play, and these are perhaps other governmental programs or plans as part of a retirement program or whatever it happens to be. These type of folks that are on those programs are aware of that claims process. These are probably the individuals where you wouldn't see as much of a demand for an MA or a Med Sup program, because they have already a secondary, or in this case, a third coverage, much as they would have if they enrolled in an MA or a Medicare Supplement program. You have different contact information that's going to be made available to you as well. A lot of this is in that guide. Well, I'll take that back. All of this is in the guide that will come to you as well. to make certain that we have access to the material that's necessary for us to carry on an intelligent conversation for the folks that are part of this demographic. There are also a ton of free resources that are available to veterans of all types beyond the VA. And there's some really cool programs where they can get help with finance and career through different organizations, community organizations throughout their home area, and an area where they can connect with the folks that have like interests or have been in a similar situation. So they are available then to help them with a sense of community. And there's even programs that are available to help with transportation. We're seeing an increasing number of Medicare Advantage plans that have a transportation benefit, but a veteran has additional options available in many circumstances as well. What you'll see also is an opportunity to access assistance from carriers that have dealt with this population for a long time. Humana has an incredible reputation of dealing with or working with the veteran population. And you would see in many circumstances here, pardon me, they have presentations made available and they have trainings available that are available for you as a contracted agent with Humana. They also then speak to the different places where they can go, what they can and cannot do. And these guides, this particular presentation will not come to you because it is slightly dated, and I want to make certain that everything you get is totally up to date. But you'll see that they do a very good job in not only helping educate you to the choices, but some different things that can come into play for the population you're looking to serve. Pardon me, my system is frozen here. Come on now. Pardon me. Well, if we're going to be that way, let's go to Plan B. Folks, there we go. I'm back. Sorry, computer problems. We dropped the line. The joy of VoIP here. But what we have here is also a presentation delivered by United Healthcare. They are also active in this market, and active to the point where my computer is frozen again. Oh my. But much as what Humana does, they have also much collateral that help you market to this population as well. And I think we're regaining some things here, perhaps. Bear with me. We are once again ad-libbing. And I apologize, folks. Let's see if we can't go to an additional viewing of this. To continue, there's not much left. Obviously, you're almost at the top of the hour as well. It's not there for us. I apologize. What we have coming up in the next 3 slides is actually some illustrations of the different programs that Humana has in play for this population. I'm going to try something else here. Bear with me. I know we went black there for a minute. Bear with me. The joys of Task Manager. Maybe this can clear some of this up. Sorry. It doesn't appear to be working. Boy, I apologize. We're attempting to pull up a copy of this presentation and work off of that. There we go. I just blew through it for us. Pardon me. What you see is Humana is very active in advertising some of the assistance that they do. They stage trainings, live trainings throughout the country on this topic. They've come on and have given webinars with us as well. I'm actually going to include a link to the last webinar that they give with us with their presentation to the follow-up to our presentation here with its slight lump there. There are a ton of material available on their agent website for you to use, different flyers that help advertise events. And you see some of that same piece come into play with United Healthcare, where they'll provide much of the information that you see as well, and some of that marketing pieces that come into play. I am not suggesting they are the only 2 Medicare Advantage programs that work this area, but they are 2 of the most active, and we'll have some additional information as part of the follow-up with some of the other carriers as well. So when we look at this, I think one of the first things we need to do is adopt the same mindset of a physician. First, do no harm. What we need to do is a very thorough fact finder with the population, ask questions, listen carefully, consider their needs and lifestyle, recommend coverages to supplement the current coverage if necessary. That may mean just ancillary programs, because dental programs aren't too good, you know, and everybody's afraid of cancer and heart attack and stroke. I sure am. Had them all. And then this is a population, because they do associate with each other, is it good for a referral basis. I mean, we've gotten a lightening up on how we can handle that now with some of the recent Medicare marketing guidelines. And it's always important to thank them for their service. It's amazing how you can see someone in a grocery store at an event that's wearing a hat that says they're a World War II veteran or a Korean War veteran or Vietnam veteran, and how their eyes light up when you thank them for their service. This is a piece that reminds me, how do we do what we do? Well, we talk about the good, the bad, and the ugly. It's important that we describe the benefits in detail that they may or may not be entitled to, or may not qualify for, but work through their entire situation and see how we can best serve them, because we have a full portfolio to use in order to do so. And moving beyond Medicare programs, you also need to look at perhaps final expense programs, because quite frankly, they don't get a lot when it comes to burial. And we can help them with pre-planning services through Legacy Safeguard, one of the programs we help for pre-needs, developing a plan for the future, and help determine if additional coverage is necessary for them for their interment once they're passed. There's also some things that come into play, because in the past, the VA's not paid for cremation services, much less expensive in many circumstances than burial. But if they are buried in a national cemetery or in a private cemetery, those coverages differ. It's also important to note that if they're going into a nursing home, is the cost for that care service related or not? And many of the folks that are in need of this service, they find out too late that they should have had a longer short-term care policy, because it's not just if they qualify for that service for a nursing home, because there are different types of coverage percentages in this population. And we see the older folks, they may have a long-term care policy. It's also important to note that many of the short-term care policies may be sufficient if they're going into a care facility. But part of the challenge that you see with these folks is which type of facility can they qualify for, and what's it going to cost them? Because you have 3 different opportunities for nursing care for veterans, and it varies on the circumstances what they pay in those facilities at all. In many cases, it may be a full payment, but in some, they may be coming out of pocket regardless. And that is where our coverages with long-term care insurance, short-term care insurance, the life insurance programs with living benefits might come into play to help these individuals, because it's not just a question of cost, it's also a question of qualifying for it in a timely manner. I have an older brother who suffered a grievous stroke a couple years ago and was in the hospital for an extended period of time. They put him in a skilled nursing facility upon the release from the hospital for therapy. They went through all that, and then they looked to have him go into a VA facility. Well, there weren't spaces available. He's in rural Nebraska. Ironically, he wound up in a facility in our organization's hometown of North Fork, but it took a while to get there. In the meantime, he wasn't able to be cared for at home because of the severity of the stroke. He's still in a wheelchair 2 years later with residual damage on the left side, wheelchair bound. They couldn't take care of him at home. So they had out-of-pocket expenses at a care facility until a space opened up in a state veterans home. And originally, that timetable was for a space to open up just shy of 3 years. When you look at the cost of a long-term care facility, you realize then that that's an expensive proposition, and we need to plan for that. And many of these older veterans are suspect to that sort of health circumstance, as we all are, but it is a circumstance then of how long is it going to take to get in there? Are we prepared financially for the expenditure of those funds in order to take care of them in the meantime? So what we have is not only the additional assistance that we can deliver for those individuals for general health care, also for life insurance or final expense, also for long or short-term care. Keep in mind, we went through some of the things that the veterans don't get when it comes to what we consider as the working folks still, or if you're retired, those things that are part of our health care, even though they're not necessarily medical in nature. Having assistance for dental, vision, and hearing programs, having help with challenges with cancer. We saw in both those programs where TriCare for Life, we can possibly get the assistance for that chemotherapy and radiation treatment, that 20%. Many of the MA plans, that's a hole in the coverage. Most of them, it is 20% up to the stop loss. So it's limited, unlike with original Medicare, but the maximum for a max out of pocket for a VA or MA plan right now is $6,700. A lot of the plans are much lower than that, but what we see next year as ESRD beneficiaries are going to be eligible in the future for an MA plan, that exclusion is going to come off. There's talk of expanding that MOOP as well. So we need to be aware of some of those challenges and how we can help address them with the cancer, heart attack, stroke program, hospital indemnity programs, dental, hearing, vision programs, in addition to that base medical, life insurance, final expense, and long-term care. Some of the things we're going to help you with here at Premier, in order to have that broad portfolio, it's nice to be able to set up a repository of your agent information, a profile, and contract with these carriers electronically, so you don't have to fill out multiple contracts. That allows you to do it. And as an independent agent, we need to protect our financial well-being as well through errors and admissions coverage. Most carriers require it anyway. This coverage requires you regardless of whom you're contracting through. We realize that very few agents put all of their contracts with a single marketing organization. This will cover you regardless of whom you contract through. Obviously, we'd like all your contracts, but there may be circumstances in certain areas where we don't have that, even though we're a huge organization. This will give you that assistance across the board. We also help you keep your license in play with discounted continuing education bundles through WebCE and our association with those that organization. We also help you with your own benefit package, which includes non-cancelable DI coverage at a discounted rate on a modified guarantee issue basis, where you're sharing in the commission of your own coverage. A great benefit for folks where DI is a concern and something you really need to do. Some of the things we can help you with as well when it comes time to compare some of the different programs and make them available to the public in a compliant fashion. This quoting tool gives you an opportunity to do a complimentary Medicare supplement review, make certain that you have the carriers in your portfolio that make you competitive in your market. It's a great way also to get base information on the Medicare Advantage programs. And if you run into a home where they have a Medicare Advantage program in place, it's a way that you can also fill in the gaps of that program. We went through, the cost of a hospital stay when you had the daily copay, or the out-of-pocket obligations that you have for those chemo and radiation treatments. It gives you an opportunity to cross-fill with hospital indemnity programs, add-on dental programs, and do it all in a singular type of fashion. Since you are also going to talk about all kinds of Medicare coverage, it's important that you have an opportunity to keep and store an electronic scope of appointment. This program allows you to do so, as does our Medicare Center program that gives you the opportunity to send out information on Medicare Advantage and PDP programs, comparing programs. One of the few programs out there that allows you to do that outside of the plan finder on Medicare.gov that had so many challenges last fall. It gives you the opportunity to do that remotely as well. And in many circumstances, you may run across a veteran who they're not going to make a decision that first appointment. Well, this gives you the opportunity to follow up with them electronically and minimize some of your windshield time and conduct a telephonic close or an email close or a text close for those individuals that have the information previously from your prior appointment. We do have these webinars on a regular basis, and they are recorded. You have an opportunity to access them 24/7 through our website under the calendar, webinar calendar, and they are on our YouTube channel as well. Many of the programs that are offered to the population not only have different incentives offered by the carrier that's underwriting those programs, but they may also help you qualify for our producers convention. This year, it's a trip from Miami to the Bahamas, a cruise. We also help you with different lead programs that give you an opportunity to access a custom list, order just for you, discounted rate or fully subsidized, depending upon your contracting situation with our organization. We also help you work through different community-based marketing programs. Retail marketing, it's never going to stop now, guys. There are folks in Walmarts now. There are folks in different carrier retail opportunities, marketing situations that go on year-round as well. And then there are opportunities for you to reach out to different centers of influence into the community. For those that you are comfortable in seminar selling, working with faith-based organizations, that's a great way to do it. And offering explanations on VA coverage is a great topic to put into your rotation that you visit with people in these different churches, synagogues, mosques on a regular basis based on presentations we have available pre-vetted for you. And since there are opportunities to market not only with the private providers that give your veterans both an opportunity with civilian providers, it also gives you opportunities to learn how to work with the providers within the VA community. There are certain carriers that will help you as well with different generated prospects. Depending upon who you sail the ship with, there are carriers out there that will really support marketing opportunities year-round that can give you cross-selling opportunities within different subsets of the Medicare world, with Medicare supplements, regular MA plans, chronic SNP programs, dual special needs programs, different things that can come into play. We do have also Facebook lead programs, very much underway in our final expense area. We're rolling it out for the Medicare folks, and we do help with direct mail support, where we do a heavy subsidy program based on production. And that's available for you each and every month. It's an opportunity where we want to work with you. We want to make certain that the material we send you helps you be comfortable with this subset of the Medicare market, and that you have an opportunity to expand your business with us moving forward. So if you think that this is an area where you would like additional information, we will have also an additional program set into play on how to market to this population, not just knowing what it is, but how to reach out for that. I would have included it in today's presentation, but I've already gone long. The computer programs didn't help. But if this is something that you want to become involved in, watch for the follow-up that we send out. We're going to be following up with you telephonically as well. Hopefully we catch all of you. But if you see this, kick it back and say, hey, I want more details, and we'll make certain that we push you to the front of the line. All that said, you can reach out to us here at Premier at our toll-free number at 1-800-365-8208. You can get in touch with any health marketer that you've been dealing with. If you're new to our organization, we'll make certain that we take care of you. And you can reach us through our website at premiersmi.com as well. I want to thank you for your understanding with some of the challenges we had with the system there for a bit. I thank you for bearing with us. I appreciate the extra investment of your time. I'm finally going to shut up and let you get back to your day. We look forward to the discussions we'll have in the near future. And until that time, we wish you good selling. Thanks so very much, and we'll talk to you soon.